On June 8, 2012, the Jordan Institute for Families at the UNC School of Social Work convened a unique leadership event that attracted citizen leaders from across the state. The purpose of the event was to broaden the base of support for new ideas and shared leadership that would improve the system of services for people with mental illness or intellectual developmental disabilities and substance abuse. The meeting was kicked off by State Representative Nelson Dollar and Secretary of the North Carolina Department of Health and Human Services, Delia. They were introduced that morning by Gary Nelson, the Associate Director of the Jordan Institute for Families.
So I'd like to welcome up Representative Nelson Dollar. He is the current Vice Chair of Appropriations and Chair of the Health and Human Services Committee.
The folks around, you around these tables are the ones that are going to be working on coming up with policies, with recommendations, with insights that we as the folks in the General Assembly and all need to have in terms of guidance in what we do and what we advocate for and what we try to make sure is ultimately reflected in our budgets and in the structures that we establish from the General Assembly.
So I really applaud you for the willingness to come together and for the willingness to continue to talk and be transparent. But that talk and that transparency has to be active, and it has to go beyond the borders of those of us who are, and I'll put this in quote, professionals in the field. Because I want to implore you to think about the reason why we're doing all this. And the reason are the recipients of the service, the patients out there, the hundreds of thousands of people who count on and deserve the services that all of us are trying to deliver.
Perspectives from across many sectors of the system were shared, including those of individuals and family members.
One of my hopes is that we might rewrite some of the service definitions, because consumers have come to understand that the fee-for-service world is a mental health industry that chugs along on definitions. So if we can play with some of those definitions and we plug in those punch cards, the service industry, the fee-for-service industry might change direction.
Really the key to all of this is whether there will be action post this meeting and whether we'll be able to see these consensus recommendations move forward and actually be implemented and see us starting to achieve some of the outcomes that we so dearly are committed to seeing.
I think so. I think the more communication, the more we discuss these topics across the various systems from the various perspectives, the better. I would love to have meetings like this in community where half the people have absolutely no idea today what the mental health, developmental disabilities, and substance abuse system is. And so that those discussions would include people that really are not aware of our system. And so we can start thinking about how that works and what they expect from us and what they want to see from us, and for us to tell them how what we do affects them. So, that's my vision.
Well, I think one of the critical elements of transforming the system has to do with using evidence about what's effective to drive what we implement. And we really need to pay attention to what the field says and what different evidence there is about what kind of practices work and what it takes to implement them.
This is probably my first meeting where I was able to see everyone in one room, which usually takes me a year to see so many people in so many different venues. So it's really nice to see the legislators here, the payer sources are here, the MCOs are here, providers are here, and most importantly, the consumers are here.
The system is currently underfunded, so there's not enough money provided currently to meet the basic needs, so that even if we do an excellent job at managing the resources that we have now, we still won't have enough money to meet all the needs of all of our consumers without some way of creating some additional financial incentives within the system to meet those needs.
The discussions produced a list of recommendations that were voted on by participants. Those recommendations will be reported to different branches of the state government, including the current and future General Assembly and the current and future governor. Many participants made commitments that day to continue this discussion within their local communities and to reconvene as the Leadership Congress in 2013.
Medicaid's it's a lot of money. The waiver provides a lot of flexibility, and we hope at Medicaid that means services will be better Services and supports will be responsive, will be better. Folks will have better lives because that area of their life receives some extra special good attention. But we know that we are just a part of the system. We want our part to be excellent, but we're part of this bigger system. So everybody in this room needs to work to make this system good, waiver or not.
And so there's many, many, many next steps that need to be taken. And I think that we've heard that all day. And I hope that there's a consensus in the room that this is a beginning, because I certainly have felt that throughout the day, that this is a place to start.
Today, I think sitting down, all of us as a group, is almost like an exhale to where we can be here and we're going to be who we are and we're going to do what our responsibilities are when we walk out of here. But the commitment needs to be that we try to figure out ways, whether it be individually or collectively, keep what we've got going.
We're afraid of failing those we love and care for, who are fragile, who are in need, who are struggling to maintain, who desperately desire to be, who are intended to be. We are all intended to be. Everyone has something to teach. My daughter Isabel is my greatest teacher. What can we learn from one another? This is an extraordinary opportunity, and I hope it won't be our last. We are all experts in our lives, and it is personal. So how can we fix this? Thanks.